Thank you so much for joining us today for Healthline 3. I'm Carly Flynn Morgan. Today we're talking about the topic of cellulite with cosmetic surgeon Dr. McIntyre Bridges of Bridges to Beauty. He'll be answering your questions for the next half hour, and we want to encourage you to ask what's on your mind. To do so, if you're online, just click on the orange Healthline 3 box halfway down the right side of your screen, type in your question and submit it, or you can just give us a call. That number is 318-219-4569. It's right there at the bottom of your screen. It should stay up there through the show, and we will be taking your questions at that number until 12:30. Dr. Bridges, thanks so much for being here with us today.
Carly, my pleasure.
This is a problem I know a lot of women suffer from, different ages, different sizes. Let's just start out by talking a little bit about what is cellulite, because I think there are a lot of misconceptions.
Well, there are. Cellulite is generally just found in women, okay, because structurally the way the fibrous tissue is set up in the fatty layer just about a centimeter and a half below the skin is different than you'll find in men.
That was going to be one of my questions. Yeah. Do men suffer from this too? Because pretty much you only ever hear women complaining about it.
Right. Typically men, it tends to be an estrogen related issue, okay, and you can actually see that in the fetus, as early as in utero. If you see the little fatty layer, the fibrous tissue in women going from the muscle up to the skin is straight up and down, versus in men it's more of a diamond shape, so it gives you a little bit more of an accordion type of movement versus being tethered down to the underlying tissues. As we mature and we gain weight, and women go through estrogen increases in their teens, they put on more fat in certain areas like hips, thighs, gives you more curves. That fibrous tissue doesn't tend to lengthen when that fat is starting to fill up that fibrous area, and so the areas that are held down more tightly to the underlying muscles are pulled in, whereas the areas that aren't tend to kind of bulge up, and so that gives you either a wavy, what is called a mattress pattern type of cellulite, or it can even give you what I call that hale dent, or a combination of both.
Okay, so how many women do you see at your practice coming in complaining of cellulite, asking for solutions? Is it pretty common around here?
Pretty common, yeah. Pretty common. We get a couple a week actually, and it's they're concerned about, like you're saying, not being able to wear shorts, or just don't like the cottage cheese look of the skin. And the cellulite, it's you have to break up the architecture that causes it, as well as take out a little bit of fat and tighten the skin on top. There are other devices that basically will reduce the appearance of cellulite, but they really don't get rid of it because of the fact that you haven't done anything about the deep architecture. You've either done something at the surface level, which may have a little tightening of the skin, or just cause edema in the skin, which when the skin's swollen a little bit, it always looks better.
And the cellulase is the product that you have. Is it, I don't know if it's a product or a machine, or
machine.
It's a machine. The machine that you have been really happy with the results. Tell us about the cellulase, and I do think we have a video that we can show you as you're talking about it as well.
Okay. The cellulase basically is a laser assisted. You want to just watch that? Or?
Oh yeah, no. This can just play while we talk about it. You can explain. It's kind of showing how it works.
In this photograph, you see where the fat is herniated up, but you also see those bands of fibrous tissue that go straight up and down. And what you're doing with the cellulite or cellulase is you're dividing those bands and allowing the valleys to come up to the hills, and then you're turning the laser on the areas where you have the puffed up fat to allow that to come down. So you're bringing down the hills and you're bringing up the valleys, and then you're able to turn that laser up towards the skin, and you warm it up to 44 degrees centigrade. That seems to be a magic number in order to get physiologic tightening of the skin, and that's what you see on that last portion, where basically they're doing that. That last little area where it looked like the bands were a little bit more not straight up and down but horizontal is the results afterwards. So if you look at long-term results, and longest-term results probably closer to six years or so, there really isn't any recurrence, because you changed architecture. I mean, if you were just to tighten the skin, you don't change the architecture, that comes back.
So it looked like in the video that this laser goes under the skin. Is it a puncture thing where it does go into the skin, or is it on top?
No, it's underneath. The ones that you see on top are they've touted mainly for like a lipo reduction, just not really for cellulite and things, but for lipo reduction. But the problem is they don't kill the fat cells. Okay, so basically it causes them to release the fat, but the fat's going to come back because it just does, and we're Americans. So you really don't get a long-term result with that. Okay, it's only when you take care of the architecture underneath the skin, you know, contour the fat layer, which is a fairly thin fat layer, to make it smooth, and then tighten the skin is where you get the best results.
Do you put people to sleep for this? Do you give them numbing cream, just pain medicine? How does it work, and what do your patients describe the pain to be like?
Well, actually, it's an in-office procedure. Okay, you don't have to have general anesthesia for it. It's like when we do smart lipo in the office, you don't need general anesthesia. We do give some medications to sedate them, but again, you're not asleep completely. Okay, but you don't remember anything. We make a little bit of a puncture with a little lidocaine that might sting a little bit, but then we fill the area up with tumescence fluid, similar to what you find in liposuction, which is just some normal saline or salt water, same concentration that runs around our blood. Your anesthetic agents, okay, as well as a little epinephrine, and then that numbs everything. And so you're able to do what you need to do without the patient being uncomfortable whatsoever.
So what do they describe the pain to be like, did you say?
Really, they don't describe pain at all.
Oh, okay.
I mean, when I initially start and I have to numb a little spot area with some straight lidocaine, if they feel any stinging, they'll feel that. After that point, they might feel a little pressure when we're putting in the tumescence fluid, but after that, it's smooth sailing. Getting
rid of cellulite with no pain, that sounds pretty good. Mm-hmm. What about bruising or scarring?
Actually, bruising with cellulite is, plus minus. I mean, with the smart lipo, it's not as much. I mean, some people can bruise with the cellulite because we go real superficial to the skin. And, if you've got little spider veins and stuff, you're going to disrupt one of those. Even though the laser coagulates that vessel, people still will have a little bit of bruising. It doesn't last very long at all. We do have them wear a little compression garment afterwards. The scars, there's multiple small ones that basically might be the size of a pencil lead, maybe a little bit bigger, because that's the size of the laser that goes in, and so they blend in very nicely. Really haven't had complaints as far as with scarring or any disfiguration with a scar.
How much does a procedure like this cost?
Well, it all depends upon the area that you're doing, and you divide it up into sites, like lateral portion of the leg all the way down here will be one site, medial thigh will be another, then sometime in the back you can add a little bit more. It runs somewhere between $3,000 probably to $5,000. If you had to go to a facility and stuff, it would certainly be a lot more.
Is this a one and you're done type deal? Can you get it all done in one office visit and knock it out and never have to go again? Or is it more like some other laser procedures like laser hair removal where to make it actually work, you have to go back time and time again?
Right. Well, compared to laser hair removal, remember when you're targeting hair, what you see on the outside or what you're targeting is only 70% of all the hair follicles that are there. You have some that don't have a shaft, and so you have to come back for multiple treatments because the ones that don't have a shaft will grow a shaft, and there's your target. Whereas this, once you take care of the architecture, in other words, once you take care of the fibrous bands that are holding it down, give you that kind of striped look, or like I said, the hail dent look, or the cottage cheese look, then that should be it. I see most people get between an 80 to 95% reduction in cellulite. I mean, nothing's 100%, just like any operation or any function that humans do. But they're thoroughly pleased with it.
How does this technology compare with prior procedures for cellulite? Is it for a long time, or are you upgraded from another machine?
Actually, this is the first of its kind.
Wow.
Okay. And again, the longest studies are approximately 6 years long, but it was only released a year, maybe a year and a half ago to practitioners because the FDA approved it, said it works, and it was safe.
So this isn't like you hear on TV and in some of the radio ads, oh, cellulite wraps, and they wrap your body, and sometimes you're kind of like, I wonder if that really works. This is FDA approved. The FDA says that this works, and you've seen the results yourself.
Yes, the FDA says it works. Again, you get a reduction of 80 to 95%. Now, the skin tightening component of it, I always tell people there's a couple operations that I do which require some patience. Okay, if someone comes in, they have cellulite, but their skin quality is just not the greatest in the world, this machine will actually increase the thickness of the skin by about 25%, which is similar to what you had when you're in your teens. And it also causes contraction, or at least tightening. Now, that's a physiologic event, so it takes some time. Typically what you see is someone comes in, they have the cellulite done and things, when the swelling's kind of going down about 6 weeks, most of the swelling's gone in a couple weeks, okay, but they'll still have a little bit, but it's not noticeable. Generally by 6 weeks to 3 months and stuff, they'll come in and say, yeah, I see a difference and stuff. I kind of like their difference, and say, well, you just need to hold on because it gets better over the course out to anywhere 6 months to 8 months. It becomes smoother and smoother and smoother, because that skin, again, is not, when you break up the fibrous tissue, when you melt the fat, that's more kind of carpentry. Okay, it has nothing to do with physiology, because you're breaking up bands, like taking out 2x4s if you're trying to knock out a wall and things. So basically that's mechanical. The melting fat, again, it's more of a mechanical. You're getting rid of fat cells, but the tightening the skin depends upon how the skin reacts over time, okay, to that warming up to 44 degrees centigrade. It's just the tightening improves. And again, the long-term studies show that the results are so far permanent. And it's probably because you changed that straight up and down little fibrous tissue into more of a crosshatch, and that's more like a male pattern, and males really don't get cellulite.
Permanent results with little to no pain sounds pretty good. This cellulase sounds like a pretty good new product.
Yeah.
Tell me a little bit about your typical cellulite patient, or the typical cellulite sufferer. Does it hit women of all different ages, of all different sizes, or does it kind of coincide with weight gain or with age?
Really, all of those. I mean, I've seen it in the 20s. Most women in the 20s will have what's called that mattress pattern, where if they look back there, they'll see these someone's taken the fingers and indented their skin, and that fibrous tissue that's holding it down is a band, okay, versus the ones where you'll see individual dents, on the thighs. That's where there's a real tight band that's just holding it down. You can think of it almost like a little fishing line. It doesn't give, with weight gain, the tissues around do, so it makes it worse. If people lose weight, it always looks better, but it doesn't take away that architecture. So as soon as they gain weight again, because Americans, we usually go through that 3 to 7 pound cycle throughout the year, and so when you're want to look good for the summer and things, you want to lose some weight, sometimes we don't make it, and the cellulite is just there.
How many of these procedures do you do at your office, weekly or monthly?
Really 1 or 2 a week. I mean, it's been fairly common. It's been a very good device to use. I mean, it's like with the Smart Lipo, we'll do 2 or 3 of those a week in the office, and sometimes we'll do them in combination. If someone has some cellulite, needs some areas of the thighs or abdomen or flanks contoured, we'll do it at the same time.
You talked a little bit earlier about how you can, when you're in there, you can hit some spider veins and things like that. Will that actually help if you have other issues like spider veins or anything else? Are there any other benefits to the cellulase?
Well, I've seen it improve spider veins. I haven't seen it make it worse. The spider veins, I mean, there's other techniques to take care of it. We have lasers for that. We have sclerosing agents. Again, very effective. They take a little bit longer period of time for it to resolve, because it's an injury, and again, it's more of a physiologic thing versus trying to take out little spider veins, which is relatively impossible.
Can you, if you do have spider veins, can you kind of come in and get a couple procedures at one time? Say you wanted to take care of your legs, you wanted to get the cellulase and your spider veins taken care of with a different procedure. Can you do that all at one time?
You generally can't. Okay, just because when you do the spider veins, you need to have the blood flowing through those spider veins for the target, for the laser target. When you inject that fluid into the area that you're trying to do the cellulase on, you're squeezing all the blood out. That's what tumescent fluid, what it does is not only numb the tissues, it also squeezes out any blood vessels, any blood that's in the blood vessels. You're still going to nick some blood vessels, but if they don't have any blood in it, then you don't have as much bruising. I mean, it's not bad. People don't come back like black and blue. They have little spot areas on occasion.
I'm checking to see if we have any questions online right now, and we do not at this point. But I did want to talk a little bit about, you said there's minimal pain involved here. What about activity afterward? Can you go right back to normal and exercise and stand as much, or is there a few days of downtime?
There's about a week of downtime. If they're really in terms of just exercise and getting out there and run, I always tell people a couple weeks. And when they do, the skin will feel a bit of what I call woody for a while, but that all passes. It's only because it's swollen. And remember, everything I do, as I always say, it's a calculated trauma, and your body has to kind of cope with it. So it's going to do certain things, and they're expected things over the course of a period of time.
When you say your skin feels kind of woody, what do you mean by that?
Well, if you go to the dentist and they give you that little shot and things, it'll feel a little bit bigger. Okay, when it's starting to, the numbness is starting to go away, if you run your finger across it, it still feels, you can feel it, but it just feels kind of woody or numb, or not quite as sensitive as it was before.
Can you use this cellulase on other parts of your body? I know people have problems with their arms. Is it necessarily cellulite on their arms? Have you ever heard of that being used? No,
cellulite can be found on the arms. Usually we use it in combination with the Smart Lipo, because women especially, they'll I don't know why, but they'll collect fat along that posterior portion of their arms, and it's best to, and if they have some cellulite with it, then you can take out the fatty deep tissues and stuff, then contour the superficial tissues to kind of get, number one, tightening of the skin, as well as remove the cellulase. But the cellulase can be used, even in neck contouring, because of its ability to get close to the surface of the skin. The way the laser is set up, the laser comes out the front, but there's also a port, that's what makes this unique, that comes out at 90 degrees, so you can actually angle directly onto the undersurface of the skin with it to heat it up. Whereas with the Smart Lipo, to heat it up, you have to kind of run it underneath the skin, much more than directly focusing the heat. But again, it's heating it up that is the main component when it comes to final skin tightening. But for the neck and things, people have, little sagginess in the neck. And if there's not a muscle component to it, like, there's little muscles that tend to kind of make little bands or strands, then basically you can help correct that.
Interesting. Once people have this procedure, is there anything that you suggest for them? I know you had said it kind of is a permanent fix, but is there anything else you can suggest so that they don't have cellulite issues in the future?
Well, no. I mean, there's not really, if you leave an area that basically still has that architecture, it potentially can have, some cellulite. It's all about the way those fiber strands are oriented, and you need to break them up, let them release. If you just did it mechanically, like with lipo, you would think, well, I can do lipo and basically that will take care of it. Lipo actually spreads the fibrous tissue apart, but they still are oriented straight up and down. If you were to actually try to cut each of the individuals, say with the cellulite cannula or device to kind of break it up, the fibrous tissue doesn't retract away from each other as well. And so if you heat it up, though, just like if you're, chicken skin, if you put heat to that and things, it tends to kind of shrink up. Okay, you want the ends of that fibrous tissue that you cut to shrink away from each other, to pull away from each other, so that when it heals, again, it's more in a diamond shaped or a diagonal shape versus straight up and down. Just mechanical with just plain steel or cannulas kind of situation, it doesn't tend to do that.
So, you read a lot of women's magazines and a lot of talk between women about what you can do to get rid of cellulite, diet, certain exercises, maybe, I don't know, wear certain clothes, certain compression. Really, it has nothing to do with any of that, is what you're saying. It's just kind of what you got from your mom. What you got from your mama.
Well, for being a woman.
Yeah.
That's the main thing. Yeah, the other things that might give you a temporary reduction in the appearance. The wraps. Basically, they probably force those little herniated areas of fat kind of down, and they'll stay there for a little bit. But as soon as, those cells start to fill up again, it will puff it out. They used to have like creams, like they used to have aminophylline, which is part part, but it's an asthma drug. At least, well, you can put this on there, and it tends to kind of, it'll make it better. There's really no physiological reason for it to make it better, and it just, I mean, it was a fad. I mean, I remember 5 years ago, maybe even longer, probably longer than that, where everybody was using anonophyllene creams. Obviously, it didn't last because it didn't work.
Because nobody's doing it anymore. So any of those things that you hear about may give it a better appearance for a very slight period of time, but this is something that the FDA has approved that is a permanent fix.
Yes.
Very good.
Yeah.
How does this laser compare to like laser hair removal? Is it the same type of laser, or is it different?
No, all lasers have what I call a target color that they focus in on. The hair removal laser is really has a similar frequency as those for the leg bangs, or at least the blue leg bangs. And so they only target those particular colors, browns and blues, and so it's a different wave frequency. This basically targets the molecular makeup of fat. It also targets water too, like CO2 lasers, which we use in the face for resurfacing with the Smart Skin CO2 laser targets primarily water. But you know, all the lasers are developed to target specific, you know, tissues for specific needs, and that's so they're really not the same type of laser.
Is there anything else that I haven't mentioned about the cellulase that you think it's important for people to know, or that you wanted to address?
Well, like I say, you can do it in conjunction with regular, you know, lipo or smart lipo. Again, we do it in the office. It's real convenient. It's very, very effective, most effective thing out there. If you look at the befores and after, I think those befores and afters are.
You can put that video up again, Anthony, if you'd like. It kind of shows how it works, and also does give a picture before and after, I think, somewhere in there, so you can check that out.
Yeah, and from what I've seen, things the befores and after here, I think you can actually get better results than that. I mean, I like the results, but you know, when I first got it, you have to be. There's
the before and after we were talking about.
Yeah, I think it is great, but I think it's getting better. I will, on occasion, if someone has an area that, you know, just pockmarked, not only will I do the cellulase, but I'll do a little fat injection to actually elevate it a little bit more, because the skin does have some memory to it. Okay? Even though you tighten it up and things, if you want, you know, even better results, a little fat injection is good. When they did these studies, which is that's what this is from, you know, those pictures, they couldn't do that because they were trying to test the parameters of the laser by itself, and so that's really the reason you see some discrepancy still in terms of cellulite. But again, I think if you go that little extra step farther, it improves it even more.
I'm sure this is a procedure that people are thinking about doing this spring, getting ready for summer. I'm sure there are several more summer-ready procedures that people want to get this time of year. We still have a few minutes left. I mean, maybe we could touch on some of those. I mean, I'm sure a lot of people are looking at breast augmentations for bikinis.
Yes.
What are some of the other things that people really come to get this time of year, besides wanting to get rid of cellulite?
Right. The breast augmentation is probably number one. Then a close second is the liposuction, or you know, the smart lipo. When I do that, and there's not as much downtime to it as regular liposuction. It doesn't tend to be as uncomfortable in most people as regular liposuction. I do have some people who are, you know, it's just as uncomfortable. And then, you know, the lasers for the spider veins and the hair removals, you know, bikini lines, things along the lines are very, very popular at this point. We have some programs going on right now that basically, you know, they're discounted as far as the hair removals and the spider veins. But, you know, we tend to kind of, portions of the business are seasonal, but this is, you know, summer ready time. Breast augmentations, liposuction, cellulase, again, very popular, as well as hair removal and leg veins.
I was going to say, this must be the busiest time of year for a plastic surgeon leading up to summer. A lot of people, you know, probably get a little self-conscious, but I mean, why not do something that can help you feel better about yourself and help you look better and feel better, especially, like you said, when this cellulase procedure is permanent?
Yes. Yeah, that's the nice thing about it. There are very few procedures that you can do that's going to be permanent. Liposuction can be reasonably permanent if you maintain your weight. Again, since this doesn't doesn't tend to vary based upon weight gain and weight loss, because again, it's more of an architecture issue than taking out fat cells. It tends to be better.
We still have a few minutes left here. I know you say that you do the most at your office, breast augmentations and tummy tucks. That's correct. That's what you see the most people for. And we talked a little bit about the summer ready procedures that you do as well. Are there any other surgeries that people come for that you do that people might not even know about?
Well, we do all the injectables. I mean, I've been surprised how popular those are, especially with the voluma, where you can fill out the cheekbones, and it actually does some lift, of the nasolabial fold regions. They're doing that for summer also. We don't do any spray tans or anything like that, and I don't, I'm not real big into tanning beds, but we do have the sunblocks kind of flying off the shelf. I think people just are preparing for the summer. I think they're doing it smart, and they have certain goals they want to meet prior to the summertime.
Let's go over one more time the main points of this cellulase. I think some of the most important things that we've covered here are the fact that it is proven to work. It's verified by the FDA, and that it's permanent. And tell us a little bit, some more about the recovery time. If people say, that all sounds pretty good, but what about the pain?
Yeah, the pain afterwards is not that bad. It's easy to cover. We give some, some lower tabs or something like that as far as the post-op. Switch them over real quickly to a non-steroidal anti-inflammatory like an Advil, because you're working in one area. It's you're going to have some inflammation. Inflammation equates to discomfort or pain. It's better to get back on that as quickly as you can. Prior to the operation, you don't want to do it because it'll make you bruise more. But it's really not that bad. I mean, after we get through, we put you in a little compression garment. That makes it feel better. Where we make the little small puncture wounds, we do leave open. You don't put a stitch there, so any fluid that wants to come out can come out and things. That's a little bit of a nuisance, but no one's ever calling saying I'm leaking too much. And so it's been, again, very, very popular, very good. Again, you can do it in the office. I mean, it's economically, without having to go to a facility and having general anesthesia, it's very economical.
And go ahead and tell us, I know the price varies, but just go ahead and tell people so they know what they can expect.
Yeah, somewhere between $4,000, and again, if you do lots of areas, and it can be up at like $6,000.
But this is something, like we said, is a permanent fix. This isn't something that you're going to do, now and then a few years down the road come back later. So that's really pretty much a lifetime price. Yeah,
I mean, if you're talking about breast augmentations, I mean, typically someone has a breast augmentation when you're young or come back later to either, to have a lift, like especially after they've had kids. So there's issues of maintenance when it comes to breast. Tummy tucks are fairly permanent, as long as they don't get pregnant after, which most people don't. I've only had 4 people in 30 years do that.
Oh, wow.
But it did turn out reasonably well. I mean, I was surprised how well it snapped back, but you can't promise that.
Right.
You don't have that crystal ball. But yeah, in terms of, length of longevity of it, so far 6 years, no change whatsoever. That's probably a pretty good indication that it's going to be permanent.
And women, you think what they're willing to spend the money on. Many women are willing to spend a lot of money on their breasts, like you said, and on their stomach. But legs are an area on women that they're also very self-conscious about, or very important to a woman's image. You would think that it would also be an area that they're willing to splurge on, especially getting ready for summer, like we said.
And they have. I mean, when we first started off, things had started off slow, but it really has picked up. It has. I mean, I've been very happy about that, and again, the results have been very good.
Well, it would be slow because it was a new machine, right? And not a lot of people know about it. And I think there's a lot of misconceptions out there about cellulite, and if any of the treatments for it really work. But it's good that you're here talking about this today, and we saw that video. We did see the before and after, and like you said, you've seen results even better than what were on that video there.
I have. Remember that, again, with the little fat injections, and I'm fairly aggressive with it anyway, so I really do heat that skin up because I want the maximum contraction with it. But if there are, again, there's certainly difficult areas where they have a real deep area that even though you release the band, it doesn't come up all the way. If you just take a little fat, because we have plenty to spread around, and inject it underneath there, it makes it even smoother. I mean, I've been very, very impressed with that. But with those studies, they couldn't do that because it wasn't part of the study.
Well, it is a problem that many women suffer from, and like we've learned today, there is a solution, a pretty permanent solution, the cellulase laser, available at Bridges to Beauty. Thank you so much, Dr. McIntyre Bridges, for being here with us today and telling us about this, because it was something I hadn't heard about.
My pleasure, Carly.
Thanks so much for being here, and we hope you have a great day, everybody.